Welcome back to Great Day, Washington. It is estimated that half of the population of the United States is diabetic or pre-diabetic. The stats are staggering and are not slowing down, even with almost 50 different medications currently on the market. According to AARP, 65-year-olds in this country are taking an average of 5 different medications each day, with the average for all type 2 diabetics being 9 per day. I'm joined by Drs. Tom and Steph Chaney of Living Health Integrative Medicine to share with us a different approach to diabetes, one that is helping patients actually reverse their type 2 diabetes. Welcome back to the show.
Hi. Thanks.
So we can have many different medications. It seems like there's so many on the market to treat diabetes. Why are the rates continually going up?
Yeah, there's over 30 different prescription medications for diabetes currently on the market, and many of the patients that come to see us are on upwards of 5 different diabetes medications at one time, and they're still experiencing a worsening of their condition. And the conventional system is really looking at managing this disease and managing a lot of the complications that happen because of diabetes, like the increased rates of cancer, heart attack, and stroke, which is the #1 killer for a type 2 diabetic, or amputations or kidney issues. So a lot of the medication is geared towards just continually managing this disease as it progressively gets worse. And so our approach is very different. We approach every individual as an individual, and what we're looking for is all of the different causes or reasons why their sugars may be high, and then going after the underlying causes, resetting the body with various types of testing and nutritional therapies and supplement therapies, lifestyle changes, and ultimately our goal is to not manage the disease. We're trying to reverse the disease.
That sounds huge for so many people suffering from diabetes and watching now. But it sounds like you're saying the causes of diabetes, like there's more than just one, and it's not simply a problem of a poor functioning pancreas.
Right, and that's what a lot of patients are told when they come to see us, is that they actually have a pancreas problem and their pancreas isn't producing enough insulin. And there's a couple of things that you may find unbelievable, is that actually patients bring in their test results, we look at their tests, and #1, most of them haven't even been tested for pancreas function, yet they're told that their pancreas isn't functioning properly. And then when we do test them, I'd say over 80% of them actually have a pancreas that is producing adequate enough insulin, but it's a problem with other areas in the body. So we look at these organs, glands, and systems, these other parts of the body that have their hand in helping to control sugars. So we see about 24 different places that we have to look, and we run some comprehensive testing to actually look at these areas and then come up with a customized plan to address these causes for that individual.
One of the places you may look is the hemoglobin A1C. It's measured periodically, and when you talk about reversing diabetes, what does that mean in relation to that?
Well, the hemoglobin A1C is really the main marker to look at medically, and most diabetics are getting that tested in the doctor's office either every 3 to 6 months, sometimes annually. That's the marker we look at to determine if someone's actually reversing their diabetes, not so much is it getting worse. And so what that marker represents is a percentage of red blood cells damaged over time by blood sugar. 5.7% to 6.4% is considered a pre-diabetic range. Over 6.4% is considered diabetic, and you really want to be targeting below 5.7 in order to be in a normal, healthy, non-diabetic range. So when we are working with a patient, we are using that marker as a way to determine if their diabetes is coming down. So for example, we recently just posted a video of a patient who's been about a year in our program. He started about a year ago with a hemoglobin A1C of about 8 or 9, and he was on 5 diabetes medications, including insulin, as well as reflux medication, blood pressure medication, and cholesterol medication. Now, over the course of 6 to 8 months, his doctor has been able to, because of our program, almost completely reverse his diabetes medication. So he's off of all of it, including insulin, and he's off of his cholesterol medication, his reflux medication. I think he's down to just 1 more medication that he hopes to be off soon. He's lost 85 pounds. He's no longer diabetic. He doesn't have joint pain anymore, and he's not missing work because of his illness anymore. So his hemoglobin A1C is now below 6, and that is our gauge as to whether or not we're helping a patient reverse their disease.
I bet there are people watching right now, they are suffering from diabetes. They have a relative or a friend, and they want to know how they can get in touch with you and start on the path, just like this success story you mentioned. Dr. Tom, where can people find out more information?
Well, the first step is to come to one of our seminars, Diabetes Solutions seminars. We actually have 2 coming up. We have one this Wednesday and one this Saturday. This Wednesday is actually full, so but we do have a couple of seats available for Saturday. And we actually have a gift for everyone. For the type 2 diabetics that come this Saturday, we're going to give a copy, free copy of Defeat Diabetes. This is our book, so everyone that comes will get a copy of that.
All right, Defeat Diabetes. So you are working with people hand in hand. The first step, though, is attending the seminar, and then you can learn more about the book that you see on your screen. Thank you so much for helping everybody in the area get healthy again.
You're welcome.
All right, so the Diabetes Solutions Seminar being held tomorrow at 6 p.m. at the Courtyard Marriott in Annapolis is full, as Dr. Tom said. The next one is taking place this Saturday, October 6th. At 10 a.m. at the Greenbelt Crown Plaza. The number to call is 888-514-4771 to register, or you can visit them online at diabetesreversalseminar.com. The seminar is absolutely free. We'll be right back.